Is going to talk about the occipital lobe.
So I'm not going to give you an anatomy course, like with anything, but I'm going to present your case. So that's going to be the structure of the presentation. So as we said, like we presented the frontal lobe, the parietal lobe, and the temporal lobe, the last one. And now we're going to present the occipital lobe. The occipital lobe is responsible for the visual stimuli, the processing of the visual stimuli, the analyzation and recognition of the visual stimuli, and the recognition of shapes, colors, and sizes. This we probably all know from the Neuroscience Neurosurgery course. Yeah? Okay. So, we have a 45-year-old male presenting in the ER with photophobia and progressive headaches. The patient had visual hallucinations and vibrant shapes and patterns, but they had no nausea, no vomiting, and there was no trauma or head injuries that actually induced these symptoms, no past medical history, and no alcohol, smoking, and drug intake. So during the physical examination, there was no distress. The vital signs, temperature, pulse, respiratory rate, blood pressure, and oxygen saturation were normal, and the systemic examination, like cardiovascular, respiratory, abdominal systems were normal. Now, during the neurological examination, there was no focal or motor sensory deficits, normal cranial nerve examination, so everything was normal. No edema or hemorrhages, this was actually the first concern. No acute neurological deterioration, seizures, etc. So, the patient presented with no histories of seizures, as we said, but he had some visual symptoms, occipital, like posterior headache. He'd seen colors and shapes, visual hallucination, and flashes. So we can predict which part of the brain is actually responsible for all these symptoms. Then we proceed with the blood count with differentials. We can see here that the inflammatory markers, the cerebral markers, and the blood tests were in limit. Nothing was abnormal. So there was no inflammation. And after we see that everything is alright, we proceed with a CT scan, the computerized tomography scan. And as you can see on the right hand side, there is a hyperdense nodule on the occipital board, on the posterior part of the brain, on the left lateral ventricle, as you can see here. Here is occipital lobe, left, right, left occipital lobe. Nodule. Then, as you should all know, after the CT scan, we proceed with MRI with contrast because we want to test the parenchyma of the occipital lobe and see what malfunctions are there. And after the CT scan, we see the MRI scan with contrast, we see this image. Left occipital lobe. As you can see here in the arrows, there is something going on here. Can someone predict what it is? 6 years students? Doctors? Yeah, it can't be a solution. So, the MRI revealed, it actually confirmed and revealed the supraependymal cavernoma here, in the occipital bone on the left ventricle of the brain, posterior part, and it was 1.2 centimeters in diameter. So, as we said, there was supraependymal cavernoma. So, what are cavernomas? Cavernomas are basically rare vascular lesions with abnormal clusters, as you can see here, abnormal clusters of dilated capillaries without actually penetrating intervening the brain tissue. You can see here, cavernomas, and the angioma, like the capillary around the brain. Now, since we have the MRI, we know what cavernoma is. We know the symptoms, hallucinations, incisions, what do we do? We proceed with a surgical intervention to remove the carcinoma. We do the posterior part craniotomy, and we do actually a dissection of the carcinoma in the surrounding area to save the space. Right here on the occipital lobe. Here you can see the procedure. It's actually a complete removal of the carcinoma. Here, there's a malformation, so the whole malformation is removed, and there's a capsule around the carcinoma. So we remove everything together. So we have the surgery. We know what it is. We remove it. So what's next? After the surgery, the patient goes in the neuro clinic for better monitoring. There is some assessment of the neurological functions, and also the patient, after the removal of the carcinoma, he reported relief of the occipital headaches. So it's another confirmation that the problem was lying on the occipital part of the brain, on the occipital lobe, the posterior part of the brain. So, as we said, no visual hallucinations. So it's another confirmation of the occipital lobe carcinoma, and the patient booked another examination follow-up for the future. So to conclude, as we saw, the clinical exam, MRI, and surgery, it's the optimal care, and also the optimal care for this case. The occipital lobe carcinomas, they present with the visual symptoms, since the area of the brain responsible for the visual input and processing is occipital lobe, not the posterior part. The headaches that patient have and the visual hallucinations were aligned with the occipital lobe functions, as we said before. That was our prediction. The MRI is the gold standard for diagnosis, and the complete resection of the carcinoma was the safe way to go. And we saw here that the early detection improves the outcomes. As you can see here, the occipital lobe is the primary visual cortex, right here, left, right, visual input and processing. This is my references. And thank you for your attention. Any questions?